Welcome to The Explainer. Today, we're diving deep into a single medication that's a huge deal for protecting people's vision. We're talking about the eye drop, Dorzolamide. You've got to wonder, right? How can one little drop of liquid possibly stand up to something as serious as glaucoma? Well, that's exactly the question we're going to answer. You see, the secret, it's all about pressure inside your eye. So let's break it down. By the time we're done here, you'll get the science, the how-to, and the really important warnings that go along with using Dorzolamide the right way. But first things first, before we can really appreciate the solution, we've got to understand the problem. Why is pressure inside the eye such a big deal to begin with? So your doctor is likely looking at one of two things here. First, there's ocular hypertension. Think of this as the warning light on your dashboard. Yeah, the pressure's high, but it hasn't caused any damage yet. Then you have glaucoma. This is more serious. It's when that high pressure has actually started to hurt the optic nerve, which can really threaten your vision. For both, the mission is exactly the same. Bring that pressure down to protect your sight. So now that we've got the problem on the table, let's bring in our solution. It's time to get properly acquainted with the medication at the heart of all this. Dorzolamide is part of a class of drugs called, get ready for it, carbonic anhydrase inhibitors. I know, it's a mouthful, but here's what you really need to know. It's a topical medication. That just means it's an eye drop that you put right on the surface of your eye. And that's a massive plus, because it gets to work exactly where the problem is, unlike older drugs in this family that you had to take as a pill. Okay, so how does it actually lower the pressure? Honestly, the best way to picture it is like turning down a faucet inside your eye that's been left running a little too high. So here's how that faucet analogy plays out. Your eye is always making this fluid called aqueous humor. Now, there's an enzyme called carbonic anhydrase 2 that basically acts as the on switch for making that fluid. Dorzoline's entire job is to show up and block that switch. Once the switch is blocked, fluid production slows way down, the faucet gets turned down, and hey, less fluid means less pressure. It's actually a really elegant and direct way to solve the problem. Knowing the science is cool, for sure, but using the medication the right way is what actually counts. So let's get down to brass tacks and talk about how to use these eye drops like a pro. I want you to remember one number, 15. Why 15? Well, if you wear soft contact lenses, this is a big one. You have to wait at least 15 minutes after putting in your Dorzolamide drops before you put your contacts back in. This is super important because the preservative in the drops can get soaked up by the lenses. And speaking of timing, it really is everything. If you're on other eye drops, you've got to give your eye a chance to absorb each one. So waiting at least 5 to 10 minutes between different kinds of drops is the rule. And don't forget, the standard dose is usually 1 drop, 3 times a day, unless your doctor has you on a combination product. Okay, now I want to share a super simple but incredibly powerful pro tip. This can make a huge difference in how well your medication works and how safe it is. It's called punctal occlusion. Sounds complicated, but it's not. You know that little corner of your eye right next to your nose? There's a tiny drain there. After you put your drop in, just gently press on that spot for a minute or 2. This does 2 fantastic things. 1, it keeps more of the medicine right there on your eye where it needs to be. And 2, it seriously cuts down on how much gets into the rest of your body, which can mean fewer side effects. And of course, with any medication, we gotta talk about side effects. Just knowing what's common can make you feel way more prepared and a lot less worried if something pops up. The first thing to know is that the vast majority of side effects are local. That just means they happen right in or around your eye. Body-wide or systemic side effects are way less common, and that's one of the main upsides of using a targeted eye drop in the first place. So what might you actually feel? Well, a little burning or stinging for a moment right after you put the drop in. That's super common. You might also have a little bit of blurry vision for a minute or 2 or some redness. But then there's one that kind of catches people by surprise. Yep, you heard that right, a bitter taste. This happens because a little bit of the medication can drain down your tear duct and into the back of your throat. It's a really well-known thing with this drug. So yeah, it's a weird feeling, but it's totally normal and not something to worry about. All right, we've talked about the what, the why, and the how. Now we have to cover the most important safety info, the stuff you absolutely, positively have to know. Just take a look at this. This right here is without a doubt the #1 most important warning. Dorzolamide is chemically related to sulfa drugs. So if you have ever had an allergic reaction to a sulfa antibiotic, it is absolutely critical that you tell your doctor before you even think about starting this. This is a non-negotiable safety check. So let's be crystal clear. There are situations where this drug should not be used. As we just hammered home, that sulfa allergy is the big one. But also, because your kidneys are what clear the drug out of your body, it shouldn't be used if you have severe kidney disease. It is vital that your doctor knows about these conditions. And finally, you have to know that dorzolamide can interact with other drugs, especially other carbonic anhydrase inhibitors you might take by mouth, or even high doses of aspirin. This is exactly why you have to tell your doctor about every single thing you take, no exceptions. So let's wrap this all up. The big takeaway is that dorzolamide is a really powerful tool. By acting like that dimmer switch on the fluid faucet in your eye, it goes right after the high pressure that puts your vision at risk. Really, your success with this medicine comes down to these 3 things. First, using it the right way, like with that punctual occlusion technique, makes a world of difference. Second, knowing that things like stinging or a bitter taste are normal can give you some peace of mind. And third, understanding those critical warnings, especially about sulfa allergies, is what keeps you safe. We've gone through a lot, from the nitty-gritty science to a simple press of a finger. So I'll leave you with this to think about. Now that you've seen how it all fits together, what's the one crucial step you'll remember to take on your own journey to protect your vision? Thanks for watching.